everyone. I'm Ravi Kumar, the CEO at Cognizant. I'm at the Cognizant Chalet at Davos in 2025. I have one of our partners and clients, the CEO of Medtronic, Geoff Martha, at our chalet. And thank you, Geoff, for joining us today here.
Hey, great to be here.
So, Geoff, tell us how is Davos? You've been to Davos many times. How is Davos this year different?
Well, there's one theme that was repetitive from the last couple of years, and that's AI. I'm also part of the healthcare community. One of the things, when I come here, the healthcare community gets together. Government, payers, commercial payers like from the U.S., providers, industry like us,
and
policymakers, and different themes there. I just got out of a meeting on brain health. A lot of things going on there with neurodegenerative disease as well as mental health, and what are we doing as a healthcare community? Both from a policy perspective and from a technology perspective, and that's where Medtronic really comes in. We come in policy, but this year we've got some great new technology coming out for neurodegenerative disease like Parkinson's and Alzheimer's. So really excited about that. And how should we take that technology forward? So talking to these different stakeholders is really helpful.
Geoff, I remember distinctly last year when AI was just about taking off.
Right.
When we were at Davos. You were one of the few who was already speaking about use cases you're already implementing at Medtronic, and some of them were really path-breaking. Tell us those one or two real game-changing use cases you're really developing at Medtronic related to AI.
Sure, I'll give you two. One is a simple one, but it's super compelling, and it gets the art of the possible. Then I'll get to maybe a little even sexier one. So the one that's simple that I talked about last year was colonoscopies, and colonoscopies is the standard of care for screening and diagnostics for colon cancer. And it turns out that physicians, when they're doing the colonoscopy procedure, they miss. Now, we found out up to 50% of the polyps that eventually lead to cancer. They're just undetectable to the eye, or maybe their eyes are tired. So we developed a machine learning algorithm based on 13 million colonoscopy videos, and we partnered with NVIDIA on this to put a chip in the GI suite, and they could run this model real time. And it turns out we're finding 50% more polyps, and we haven't changed the workflow one bit. And you're saving a lot of people's lives from cancer here, and it was really surprising to these doctors that they were missing that much. And so that's a very simple example, but the other piece is it's also democratizing healthcare. So not only are the leading physicians that you see in like developed economies like Europe and the US, but also in emerging markets where they don't have these trained physicians, all of a sudden, from a diagnostics perspective, and they're at the same level, like it equalized it overnight. So it's a simple example, but it gets to the art of the possible. Another one it's I think a more sexy one is, we think about surgical robotics and just surgery. And surgery can, it's gone from open surgery to minimally invasive. Now we're moving into robotics. And all these technologies augment, imaging augments a surgeon's eyes, the robot augments their hands, but the AI is now augmenting their brains. And what we're able to do there is democratize good surgery, whether it be pre-surgical planning software that's AI-driven, or in the middle of surgery, AI identifying structures in the body that you should stay away from, no-fly zones, guiding the physician through the surgery. And we're not replacing physicians, but like I said last year, and we're seeing this play out, physicians that aren't using AI are being replaced by ones that do. And so we're seeing, again, democratizing good surgery around the world. And we're doing things that we never thought possible with all this technology augmenting all your senses, including and then also your cognitive abilities.
And one of the things, in some ways AI has evolved from last year to this year is the agentic part of it, which is the ability to pick up the service pools which existed, but which are never tapped by humans.
Right.
And I thought connected care is a huge use case for agentic AI.
Right.
Just because the amount of monitoring you can do around it, and create insights and actually feed that back into the process of diagnostic and process of identifying disease.
Well, even just think about patients that are recovering from surgery, right? They're in the ICU or the step-down ward, and they have all these sensors on them, and it goes to a central nerve station, And they're looking at all these parameters and trying to connect them and triangulate. Is this patient in danger of being compromised and having a problem? This is where AI can connect those dots for the nurses and the healthcare staff and alert them. I mean, so I think, this is where that technology would really be helpful.
One final question in the same space, and this is something I've spoken about, the flywheel of science and technology. I mean, I would say science has contributed to technology for decades. This is the first time I get this unique way of thinking that technology can actually contribute back to science and shrink the drug development cycles, understand disease, understand the DNA of humans. I'm actually hearing a lot from life sciences companies that drug development cycles are going to go through a massive disruption.
Right.
I don't know what you're hearing about it.
No, look, I'd say even last year, for sure 2 years ago, talking to some of the pharma CEOs, they said it was, that comment was a little more hype than it was reality. But now I think with advancements, I think they're actually getting more optimistic around shortening development cycles. And for us, in the medtech world, I think there's a huge opportunity as well. Just sticking to the brain comment, we just came out with some technology where we can actually sense in the brain. That's brand new. For 40 years, we've been applying therapies to the brain, but it's a one-way conversation. We're talking to the brain and not listening because we didn't know how to listen. Now we have sensors in the brain, and there's a lot of data we're pulling out. And I think we can use these AI tools to make sense of that data and really figure out how the brain works, because it is a white space. Science doesn't really understand. That's why there's a lot of problems with these neurodegenerative diseases, no real good solutions, because we don't really understand how the brain works. And so now with these sensing technologies in the brain, we're going to learn a lot, but it's going to be an information overload unless we use some of these tools.
Terrific. Thank you so much, Geoff. Thanks for talking to us. Thank you.
All right. Thanks, Ravi.